Hi, Dr. Roger Sdao here. Thanks for joining us today. We're going to talk about sciatica. It's a very common thing that we see here in the office, very painful, extremely difficult to deal with a lot of times. So let's get right down to it. Basically, what sciatica is, it's a pain that describes and is associated specifically with the sciatic nerve as it goes down the leg. So it basically starts in the lower back, it goes down into the buttock area, down the posterior thigh and into your lower leg and feet. So from there, we can have a lot of irritations on it and a lot of things can be causing it. Most commonly, it's unilateral, meaning it's one-sided. But for the most part, we're going to get into the more common things that we see coming here into the office. Number one, I have to say it's probably herniated discs. If you didn't get a chance to go to our YouTube page, we just go to YouTube, search Freeport Family Chiropractic and Acupuncture, and there's a video there that I did that I describe the difference between a herniated disc versus a bulging disc versus a ruptured disc. And if you kind of basically take a look at your vertebrae here, when that disc bulges and starts to irritate that nerve where it comes from out of the side here, and now it's causing pressure and pain on that nerve, that can basically transform into back pain along with a lot of leg pain, going potentially all the way down into the foot. Now the sciatic nerve starts, like I said, in the lower back, and if you were to take this vertebrae here, or the spine, and take a look at the lumbar vertebrae specifically, and these last two vertebrae, L4 and L5, the nerves that are associated at those levels is where the start of the sciatic nerve, where it comes from. And then if you take the pelvis here with the sacrum, the top three levels of those nerves, S1, 2, and 3, basically make up the remaining part of the sciatic nerve. So again, it's made up of a bunch of different levels. If you were to put these together like that, you'll notice, like I said, it just comes from a bunch of different levels, and then as they come out of the spine, they all join and form one big fat nerve, like I said, goes down and tracks down the posterior leg into the feet. So again, disc herniations would be probably the number one most common thing that we see here. Leading into the second thing, something called stenosis. Now, stenosis is a narrowing of a canal or a hole. So kind of like what I was showing you before here, where again, you have your two vertebrae with a disc in between. As those two vertebrae come together, they form a hole where that nerve comes out. There basically could be a potential for that, what we call the intervertebral foramen or the intervertebral canal, to close off due to an arthritic condition, due to an increase or a buildup of soft tissue in that area. I don't want to get into specifics of that, but that could cause a stenosis. And what it does is it basically kind of chokes off that nerve as it comes out of the spine. And again, if it's one of those levels that I mentioned earlier, that can cause a potential type of a sciatica going down the leg. Most commonly, you'll have not just pain, but there'll be like a numbness, tingling sensation, sometimes burning sensation, a heaviness in the leg and into the foot. Just again, extreme amount of pain. When it lasts long enough, then you can have some sort of weakening or weakness in the muscle itself. Maybe you're not able to bend or point the toe of your foot up in the air as readily. So you'll see a lot of people kind of slapping their foot as they're walking. That indicates that there's been a huge neglect and that there's a lot of weakness in the leg. And unfortunately, that could be of a constant chronic type of a problem leading forward. Another type of a condition would be something called a facet joint injury. So what is a facet joint? So a facet joint is where when two vertebrae come together, okay, so right here and here, they basically make a joint. The technical term is called a zygapophyseal joint. So go ahead and Google that, maybe use that in a sentence today. But again, any type of irritation or injury, whether traumatic from a fall, from a car accident, just a direct blow to the spine or direct blow here can cause a lot of tissue damage, some inflammation, and that can also irritate those nerves just with the inflammation and lead to, again, a swelling and a pseudo type of sciatica where it can go down the leg. Another type of a condition very common that we see here is something called Piriformis Syndrome. Now, your piriformis muscle, if I take my pelvis here, that basically starts in this part of the sacrum here, on this part of the sacrum, not this part, and it goes to this outside part of the leg. So if I were to take a piece of paper like this, you'll kind of see how it kind of tracks, something like that. And that muscle basically goes right across the middle part of the buttock area, and it's located right underneath the glute. So if you were to basically peel the glute back, that muscle would be located right about there. And that muscle approximates very, very close to the sciatic nerve. And whenever there is some sort of a swelling in that muscle, if there's a tension, if there's a spasm in that the muscle, that can cause a pseudo type of sciatica. It's not true sciatica, because usually when that piriformis syndrome occurs, the pain does not go past the knee. It usually kind of hangs in the buttock area and into the posterior thigh. It does usually not go past the knee. So again, that's more of a pseudo type of sciatica, something that could mimic sciatica. But again, very painful, very discomforting to deal with. And that, we see a lot of that here in the office too. And then leads me to my last thing that we see here, something called sacroiliac joint dysfunction. So your sacroiliac is the joint that's located between your sacrum bone, which is this triangle bone that's fused, and your ilium bone here that I'm holding it by. So right in through here and there, that's basically your sacroiliac joint. And whenever that joint is not working or functioning correctly, whether it was from, again, could be from a traumatic thing, maybe a fall, some sort of restriction, maybe some muscle tension, or it could be from the muscle tension from a piriformis because it approximates really close and it's literally on that bone. Whether it's maybe what some chiropractors call a subluxation, or just again some kind of movement or motion restriction that's preventing that joint from working correctly, that can also cause a sciatica type symptom, where again you get some pain shooting down into the posterior thigh. It's usually, again, not all the way down into the lower leg and foot, but that pain is usually located mostly in the glute area, in the buttock area, and the posterior thigh. So again, just from basically observation, from assessing the patient, from examining the patient and diagnosing them appropriately, we want to start to rule out all these other type of things and seeing what specifically is causing those type of ailments. There's where we're going to kind of proceed with our treatment plan, whether it's with most commonly spinal manipulation, some physical modalities, whether it's an electrical muscle stimulation to see if we can help with some spasm, some pain control. We use acupuncture here in the office. We do a lot of stretching and rehab type of work, along with some kinesiology taping. Specifically, we use our Rock Tape brand type of kinesiology tape. So those are the more common things we see. By no means are those the only things that are limited to causing sciatica symptoms or sciatica type of symptoms. But those are the more common things that we see here in the office. So hopefully you enjoyed these educational videos. We have more, like I said. Go to our YouTube channel. We're on Facebook. You can follow us there. And if you ever have any questions, by all means, let us know. You can subscribe to our YouTube channel. And until then, looking forward to seeing you and hearing from you. And again, if you have any other type of questions, by all means, please call the office. Thanks a lot, and thanks for joining us. Bye-bye.